Hi everybody, Jomar Ferralis here again, Doctor of Physical Therapy, talking to you more about pain and more specifically chronic pain within a home care setting. These patients that we get for chronic pain, either through referral or have had chronic pain after getting out of the hospital, they're very tricky to work with, and they're tricky in that there's so many factors that can make their pain worse, and a lot of times it's a lot of psychosocial factors, which I kind of touched on in earlier video. So as a home care physical therapist, what is one of the first things that we can do to manage chronic pain within the home for a patient? What I do is, and this is a good tip, is, and it's very simple, call their doctor. If they're in such severe pain that they can't do anything with you during the session, or if their pain is at a 10 out of 10, a lot of times just calling the doctor and having a conversation with them regarding the patient's pain may cause the doctor to take some action. Sometimes it doesn't always work. Sometimes the doctor is already aware of the patient and is hesitant to prescribe certain drugs. However, I still think it's an important conversation to have. That way you did your due diligence and the patient is getting taken care of. So that's number one. Call the doctor, let them know about the pain that they're having. Talk to them about the medications that the patient is taking to manage that pain. Maybe it's just as simple as increasing a certain dosage. And while the PT profession has advocated for less opioids and less pain medication in the home care setting, it can be unrealistic, just because there are patients who have dealt with their pain for so long that it's almost impossible to take them off their pain medication regimen without a severe effect on their overall physical function. So while patients may be on opioids and different pain medications, things like that, it might be necessary at times. I've had patients on my caseload in the past with not only on opioids, but they've had internal baclofen pumps, things that are really meant for patients in true pain. So that would be my first tip, is to call their doctor, let them know what's going on with the patient, what their pain level is, what medications they're taking. And if you're a skilled physical therapist, you'll know and be able to describe to the doctor what activities, what things that the patient does that makes it better or worse. So that will have to come at your evaluation. But a good first step is to call the doctor.